One of the strengths of this program is certainly how well-rounded the program is and the breadth of the experience that you get. The most valuable things that I gained was mentorship that continues even to this day. We all really care about the fellowship, and it's not just come through the program, graduate, and move on. It really is try to get the best experience possible. And so we're never satisfied with how the program is. We always want to improve on the program and make it a better and better experience. In residency, you get the basic tools to be able to go out and practice ophthalmology. But as a subspecialist, you really do want to see everything that you possibly can during your one-year experience. And I think really that's one of the strengths of this program.
I was a fellow here a few years ago. I don't want to disclose how many years. I saw so many different pathologists during 1 year, and I was able to do many different kinds of surgeries. Like for example, in one day in my clinic, we will see the bread and butter like Fuchs endothelial dystrophy, dry eye disease, conjunctivitis. But also we see many complex pathologies, mucous membrane pemphigoid, Stevens-Johnson syndrome, limbal stem cell deficiencies, and these you don't see that often in many other centers.
My fellows would be seeing myself doing cornea cases, but also discuss them with cornea specialists as well as glaucoma specialists, and also have to have the very important conversation with pediatric ophthalmologists. And that interaction with so many different faculties will really enrich the training experience here, and I think it will help them to become better doctors than just their own specialty.
We are fortunate to have a very large faculty at the Stein Eye Institute. This is both clinical faculty as well as research faculty that allows our fellows to gain exposure to many different ways of practicing medicine, allows them insight into what's new, what's upcoming. Our clinical fellows have the opportunity to engage as investigators in many of these clinical trials that the faculty are engaged in, looking at new drugs, new devices, and new approaches to treating patients with anterior segment disorders, including an ongoing gene therapy trial.
Different patients come with different pathologies, and so it's nice to be able to experience all of those pathologies by having a nice mixture of a patient population. You hear all different types of languages here. We have a lot of Persian patients, Middle Eastern patients, Hispanic patients, and I think it really contributes to the strength of the program by allowing you to experience all of that.
In Los Angeles, we have many different kind of patients, and in my own specialty, we see from the children as young as a few weeks old or a few months old to adults all the way into 80, 90, or even centurions. These people bring in a range of different problems and issues that they need help with. Fellows in our program will have the opportunity to solve these issues for the diverse population.
As a trainee in ophthalmology or medicine, you learn how to relate to people from different backgrounds than you. And that ability to understand and relate and communicate effectively is critically important, I think, to making the right treatment decisions together with a patient.
Our fellowship program offers a comprehensive surgical opportunity to not only look after patients in the medical realm in the clinics, but also participate in surgeries in cases such as complex pediatric cataracts, pediatric glaucomas, and also pediatric cornea cases. As corneal fellows, you'll be able to participate in the surgery, learning not just the pre-op and perioperative issues, but also getting involved in the intraoperative perspective also.
Fortunately, I and several other members of the division are in positions in professional societies where we're able to choose speakers for meetings, to get individuals who are early in their career engaged in professional organizations. And so we're always keen to promote our former fellows, if they're interested, to those positions.
This fellowship, I believe it is one of the best and most rigorous training in cornea and external eye diseases. I enjoyed my training so much that I couldn't resist the offer to stay on as a faculty. And that's how I started my career.
I think this is a very organized program, a great faculty, a great role model. You can find the experience and expertise in all fields of the cornea and anterior segment here.
Oftentimes, Sometimes fellows are most worried about how do they have a network of not just mentors, but also referrers when they set off to in their own practice. Being a fellow in the locale and then start to develop that relationships with the optometrists, ophthalmologists, and also other care providers in the area is really the one best way to establish that foothold in the area.
We all value what it means to have good mentors, whether you're going into private practice or into academics. And also, I think our former fellows will attest to the fact that we are always available to them via email or phone call regarding difficult cases or just questions about medicine in general. I'm very pleased to be able to say that I've become friends with and maintained friendship with nearly all of our former fellows over the last 22 years that I've been fellowship director.
I still have my mentor's voice in my head when I'm operating. I can hear him just telling me that suture's not radial enough, you need to replace it. It's a great voice to have in your head when you're operating. It really is such a cool experience that you'll remember for the rest of your life.